On Thursday, 3 senators announced they have tested positive for COVID-19. Angus King of Maine, Roger Wicker of Mississippi, and John Hickenlooper of Colorado are all vaccinated. In separate statements, they say they're doing well and have mild symptoms. The Senate began its August recess earlier this month and will not reconvene until Monday, September 13th. A White House official says more than 1 million vaccine doses were administered in the U.S. Wednesday into Thursday. More than 550,000 of those were first doses. The Centers for Disease Control and Prevention is now recommending booster shots for Americans who received the Pfizer or Moderna coronavirus vaccine early on in the rollout. Natalie Brand reports from the White House.
COVID booster shots could be widely available for millions of Americans beginning next month.
We are getting indication that as time goes by, particularly in the context of the Delta variant, that the protection against infection is diminishing significantly.
Studies from overseas show fully vaccinated people are beginning to exhibit worsening symptoms in their breakthrough cases.
So in our process to stay ahead of this virus, we're starting to see it in infection. We're concerned we will see it in severe disease, and we're planning ahead to stay ahead.
But with millions still unvaccinated, President Biden announced nursing homes that receive Medicare or Medicaid payments will now need to ensure their staff is fully vaccinated.
With this announcement, I'm using the power of the federal government as a payer of health care costs to ensure we reduce those risks to our most vulnerable seniors.
The CDC says the number of people getting their first vaccine dose has fallen for 5 straight days.
I did not get the vaccination just because I feel it's government pushed on the people, pretty much. And I just feel it's poison in my eyes.
But health officials say the vaccine is still the best way to prevent infection, hospitalization, and death.
We have a pandemic of a Delta virus that's ravaging our community, and we have a pandemic of misinformation.
The U.S. had a total of 400,000 new COVID cases for the entire month of June and is now approaching nearly 2 million so far this month. Natalie Brand, CBS News, the White House.
For more, I want to bring in CBS News reporter Alexander Tin. Hi there, Alex. So as we've heard, the booster shots are only being recommended for people who received the Pfizer or Moderna vaccine. But what about people who received the Johnson & Johnson vaccine?
Well, hi, that's a really interesting question, and it's interesting for a few reasons. And let me just be clear up front that everyone I speak to in the administration and health experts say that the reason for this delay should not be interpreted, as for some reason that Johnson & Johnson recipients are being overlooked. Yes, they are a smaller share of the pie of all the vaccines that have been used in the United States, but they still represent 13.8 million people who have been fully vaccinated in the United States. The reason for the delay is basically in 2 buckets, right? The first is because of when the vaccine was rolled out. Compared to the Pfizer and Moderna vaccines, which were rolled out over the winter, you heard federal health officials say yesterday that a big reason why we just haven't been able to gather enough data yet on the Johnson & Johnson vaccine is because the major rollout of that vaccine didn't begin until March. That's important for 2 reasons. Number one, it's important because a lot of that real world evidence, the same kind of real world evidence that the CDC and FDA and top federal health officials have been monitoring to check for vaccine effectiveness and potential signs of waning immunity, that is lagging by a few months for Johnson & Johnson recipients because they're just earlier in the cycle of their immunity from the vaccine they got starting in March. Also, that's important because the actual studies that are going on right now into examining the potential changes in that immunity are at some level less, accelerated because that 8-month mark that we are focused on for the Pfizer and Moderna vaccines isn't going to come for a few more months for most of those recipients of the Johnson & Johnson vaccine. Now, federal health officials say they are waiting essentially for 2 pieces of key information that they hope we will see results from within the coming weeks in order to make a decision about Johnson & Johnson booster doses. The first is data that Johnson & Johnson itself is collecting from trials they have run of participants who got a first dose of their vaccine and then got a second dose of their vaccine 57 days, which is around 2 months after their first dose, 6 months, 12 months, and 24 months. And separate from those trials, there's also a trial going on at the NIH. that is being led by researchers that have looked at all kinds of different combinations of vaccines. For example, if you receive the Johnson & Johnson vaccine, giving you a booster dose of the Pfizer or Moderna shots and seeing if that's safe and effective. We expect that data to come within weeks.
Really interesting. So what about this 8 months, Alex? So health officials are saying people should get the booster shot 8 months after they receive their second vaccine dose. How exactly did they land on 8 months?
Well, Dr. Murthy, the Surgeon General of the United States, yesterday at the White House briefing said that this should not be interpreted as a, quote, magical number, right? Yes, you could have probably gone a few weeks earlier or a few weeks later, but they settled on 8 months for a few reasons. The first that you heard from Jeff Zients, who is the head of the White House's COVID-19 response, is that they wanted to keep it simple. You know, they didn't want this complicated system of you're trying to calculate how many days it has been since your first dose. You know, you can look at a calendar and say, okay, I got my second dose of Pfizer or my second dose of Moderna 8 months ago, and therefore by this date, on this same day, 8 months later, I need to get my, third dose of the vaccine. But in addition to its simplicity, there are a couple reasons why you couldn't go too much sooner or too much later, right? You couldn't do it too close to your first set of vaccines, as we've heard from Dr. Fauci and others, because there was a concern that that wouldn't grant real, durable, lasting immunity. You know, you don't want to be in this cycle where you're constantly giving booster and booster and booster doses. The real hope is that by spacing it out, you're going to get long-lasting immunity. The second reason is because we know the vaccines are effective to 6 months, so you don't want to give people a booster when they don't need a booster. And the third reason is you don't want to wait too late where you get to a point where people are starting to see severe side effects, hospitalization and death from COVID-19, and then you go, oh my gosh, we need to give everyone a booster. That's a key reason why they settled on 8 months, and it's also a key reason why they said they felt like they had to start planning now for this booster dose rollout, even though they're still going to wait for the FDA and the CDC to independently weigh in on this question to see whether the booster doses are really needed and how they'll be rolled out.
So, Alex, what about availability? Where should people be able to get those booster shots?
What we've heard from federal health officials up to this point is that they don't expect, at least immediately, a return to those big mass vaccination centers that we saw early in the vaccination rollout. Instead, they expect that the rollout is going to happen just like it's working now for most people who are still getting their first doses, and the same way it's worked for the flu vaccine and all those other millions of doses that are administered every year. And that's that it'll go through doctors and it'll go through local pharmacies. Now, as the rollout continues, that obviously may shift. We may see those huge lines of people waiting to get to the vaccine. But right now, the system that the CDC and the HHS, that's the Department of Health and Human Services at the federal level, has been relying on has really been working. Pharmacies are efficiently giving out doses. They're quick to report in data about the doses that they give out. And they're very efficient at handling and managing the stocks of vaccine as they get in shipments from the federal government. And that's probably the system, at least in the early days, that they're hoping to rely on.
And very quickly, Alex, on Wednesday, President Biden announced that federal funds would be withheld from nursing homes that don't require their employees to get vaccinated. How much money are we talking about, and how are nursing homes reacting?
So we don't know exactly how much money that we're talking about here, and part of the reason is we don't know how many nursing homes yet are going to be able to successfully implement a vaccination requirement or not. But we do know, and there's a great report by the Kaiser Family Foundation from a few years ago that you can look up online, you can Google it, that really estimates that most nursing home residents in this country are at least partially subsidized by Medicare and Medicaid funding. We're talking, and it depends on the state, but between 6 to 8 residents in every state of nursing homes are subsidized by these funds. So that's a significant portion of the business going to nursing homes that could potentially be at risk if they're unable to implement this vaccination requirement. Now, what you've heard from the nursing home industry and the trade groups that represent them is that it's not that they oppose vaccinations. They say they do support vaccinations, but they're frustrated that they feel like they're being singled out among businesses and healthcare providers and fear that them being required to implement this requirement when other healthcare providers aren't required to implement this requirement could severely worsen already bad staffing shortages that many nursing homes are facing as people flee their businesses to go to others.
All right, Alex Tin for us. Alex, thank you very much.
Thank you.